virtual every week and in class every week. So 2 days a week, that's what class is. You ain't doing it, hell with you, okay? Number 2, do the homework. Now, I don't have a problem with this in my class. My babies are very good. They do the homework. However, you need, and it's highlighted for a reason, you need a certain score for how many weeks in a row? 5. 5. Y'all forget that. Here go you. Oh, yeah, I got that 92%. I only needed an 85. I'm finna go take my test. You got one damn 92%. And it was sunny outside and you wasn't on your period. Your ass. Next week, you got a 64. Stop it. I said 5, okay? 5 weeks. Cumulative average, which means I really know my shit. I didn't just luck up and get a 92. Okay, so the first time, what does that mean? You never took the test before ever in your life. And put something else down just in case this is you, because some of y'all forget. You never took the test ever in your life and you're within 30 days of graduation. Don't forget the within 30 days. Some people ain't never took the test ever in their life and they graduated 30 years ago. I had a person that graduated 8 years ago. Her child got a coma. She got a bad head injury on the sidewalk at school. She went into a coma for 8 years. So when she met me, this was her first test, but there's no way in hell I called her a first-time RN. I called her for the intents and purposes of 8 years ago passing her test. Graduating from school. I told her you need to follow the repeat RN exam. Your score needs to be higher because everything that is going on 8 years later, you never even learned about 8 years ago. Stuff changed so fast, okay? So first-time RN, average score is what? So your mastery, the 5 to 25 miniature quizzes, that's what you're trying to get. It's going to take a minute, but you're going to be all right. But you're going to get it in every single freaking subject on page 4. Repeat RN, what? What about the first time LPN? And repeat LPN? Now here's why. I don't know who's an LPN in here. It really don't matter to me because I teach one level. When you are an LPN, I still have you buy the RN software because I do not believe in my heart that a heart attack shows up differently just because your ass is LPN. The heart attack still got the same damn signs and symptoms. Still got to be managed the same way. Still got to be worked up the same way. Still meds required are the same. So what the fuck am I teaching you differently for? Then this is what I say about you LPNs that you don't know yet because you ain't been in it. When you are an LPN, you are in an environment where you have no doctors and you damn sure don't have no really good nurses to fall back on. It's you with 32 people on a Saturday. So you got to actually know more than us, the RN, because the RN got 55 bazillion doctors around, can call a rapid response whenever she want to, got everybody to hold on to, cling to, ask. You ain't got no damn body. You got you, yourself, and 32 other people that depend on you because this trick called off and that one outside smoking. I've been there, done that, t-shirt, sun visor. So I'm telling you, I'm not finna treat you any different. That's why you need to buy the Uworld RN, but because it is a RN software, your score required is slightly less, okay? The RN software has EKGs. The LPN software does not. Don't waste your time. Okay, now then you got a little golden rule. If you get a score of what? When? The week you call yourself going. So you got a test on Wednesday. Last Thursday, you got a 63 in your mastery or your homework or whatever. Shit, reschedule. Your ass ain't ready. Not with no 60. Oh, hell to the double. No, you ain't ready. Reschedule. If you get a 60 anything, don't go. Please don't go, okay? Now, AA, BB, CC. You guys have told me this was the most important advice on the page. That's what you told me. These 3 right here. Right before you go, that whole week of your exam. As a matter of fact, I have a video that says 1 week before your exam, I tell you exactly what to do. This is part of what I tell you in the video. Right here, health, promotion, and maintenance, which is part of the test plan that a lot of people fail, and nobody can ever tell me what the hell this means, but I'm going to tell you. This is your maternity, your peds, your growth and development, your geriatrics, your cancer screenings, and your vaccines. That's why you are doing 150 plus Uworld RN Peds questions. In other words, you're trying to take all the questions available and do them all. You're doing your psych, you're doing your OB. Why psych? Psych is not part of this. It's not. It's actually all by itself. Because it was the first subject you did, now it got to be the last subject you do, so you won't forget what you did way back when you started. Y'all feel me on that? Okay. Now, 3, meds. You already know what's up with that. Number 4, you did fine. I read that 55 trillion times. Number 5, mandatory infectious disease lecture, face-to-face attendance. So if a student never comes, the ones in Cleveland, if a student never comes to my mandatory infectious disease lecture, the guarantee does not go. It just doesn't, because I already know that that's 22% of your test. So that's what that means. For you, here's what it means. The infectious disease pink packet that you're going to get, there is a list of infectious diseases that you will see. Those are all the diseases on the gumbo board back there. They're all going to be in a nice list for you. You must absolutely know the precautions and the treatment and whether there's a vaccine for every single one of those. So I will show you how to make a card for those. Okay, so they're on your page that you get tomorrow, so you're gonna be fine. So that is what number 5 would be for you, because obviously the guarantee is for in-house students. Then number 6, toe-to-toe performance. Nothing beats face-to-face action. You cannot replicate this at your house. It doesn't happen. This is truly just for the student in the class. And let me explain how case study boot camp toe-to-toe works. Toe-to-toe has been done forever. Ashley went to toe-to-toe, did quite well. Ashley, tell them how toe-to-toe goes.
It's very intimidating at times.
Yes.
Basically, you just sit at the table and she'll choose any topic and she'll point at you and be like, tell me about respiratory care. Tell me about, whatever disease process.
Whatever.
And you just have to be able to recall it right then and there, because
no
that's
notes.
How
No notes allowed.
You
can't study from me.
She's just so random with it, and you have to tell me about the disease process of this, tell me about this, tell me about that, and you have to recall it.
Just everything you gotta know.
Recall it, and she'll call on you a couple times when she thinks you know it, and you know your shit, then she'll be like, you're a fucking nurse, go ahead, take your test.
Yeah.
She'll tell you, but if
Get
she don't
the fuck
tell
out.
you,
Go
she'll
take
be
your
like,
test.
baby,
Yeah.
don't do nothing, just
stay there.
just stay.
So Ari and Barb and my baby Arian and Keturah, they are Nikaya. They are in toe-to-toe every Saturday or Friday. Ladies, what do we do in toe-to-toe? Ari?
Basically, you are the nurse. So she'll pick a topic and she'll ask you like, okay, what's your first nurse action? You gotta tell, you get it right, that's your patient.
Which means you won, but you really lost.
Right. So she'll basically ask you what's your first nurse action, what meds, what labs, what are you doing next, what EKGs, anything that the patient needs. You gotta go top to bottom from head to toe from the patient.
And we do case study, right? So we might say to Keturah, baby, your patient came in, they smell like urine, they are shaking, they claim they have the worst headache they've ever had in their life, and they are going through a lot of trouble at the home. They lost their job, their wife said fuck them, they was put out, they homeless, like they going through. So what's your first nursing action? I gave her a lot of shit, whole lot of shit, but she better tell me that the first nursing action is tell the patient to point to where their head hurts. Because if they point to where their head hurts and they point back here, that's a subarachnoid hemorrhage. It's going to completely change how you approach that patient. Okay? Versus, oh, they're shaking. Oh no, seizure precautions. No, I want to know what you're doing first. We'll get to all that in a minute. Now, once you tell me what your first nursing action, I'm going to ask you, well, what you think the patient got? And we're going to go all around the room till y'all figure it out. And whoever tells me what the patient got and actually gets it right, that's your damn patient. Now you got to tell me what labs the doctor's going to order and what you think those labs are going to be. So you think they're going to order ABGs? Okay, well, what the pH going to be for this patient? Well, what the CO2 going to be? Well, what the PaO2 going to be? Oh, okay, you think it's going to be a CBC? All right, well, what you think the platelet's going to look like? Well, what about the H nature? What about this and what about that? And so you're going through all those damn labs. Then I'm gonna ask you what meds you think the doctor's gonna order. For real, what's a generic name for that med? What dose would you give it? Would you give it IV? Would you give it? Oh, you want to start an IV? Oh, okay. Well, what gauge needle would you need? And what angle would you use? And how far from the site is a tourniquet? Oh, for real? Fluids? What kind of fluids? Isotonic, hypertonic, hyper. You gotta know all that without notes. That's how we do this magic in this class, because you're gonna pass. You have my name on you. I promise you, you're gonna pass. But it's not gonna be easy, because I expect you to go out of here and save God's people. I don't give a fuck about a test. This is my ministry. This is what I do. This is what I do for him, and you're gonna show it. Period. Okay? So that's what that is. So that is part of the guarantee. They don't come to that, they don't get my guarantee. Okay? Number 7, if you failed before, if you failed before, you have this crazy candidates report. Remember that? That crazy shit you burned? You know, you threw it away and shit. Y'all don't want to see it no more. If you in my class right now and you failed and you have it, thank you, Jesus. You didn't burn it. You didn't throw it away. Look at it, y'all, for real. Look at that report 2 weeks before. Here we go, check it out. Look at these percentages. Look at the subjects, because this is what it's on. As you can see, this young lady, this is her report. So I keep this one just as a souvenir, because the lady who sent me this was crying tears of joy after failing. That's weird. But this is what she said, and I never forgot it. She said, I met you the week of my exam. And I met your videos the week of my exam. I just happened to find you, and I didn't have time to do anything, and I was taking this new test. Matter of fact, her test date was 6 of last year, June of last year. The test had just changed in April. So she said, I didn't know anything about case studies. So I decided to review all your case studies. I could not review all the other 400 videos. I just focused on the ones you did with case studies. She got all aboves in every case study. Just a little bit of study in the right thing will get you your aboves. She got all aboves in the part she studied that I put out. She did not, however, have an opportunity to look at any of the other stuff. She got all belows. Okay, so this is your little cheat sheet, really, to guide you. It's gonna guide you as to what to do, where to focus the couple weeks before the test. Not for months, no, weeks before. So the 2 weeks before, she's got basic care and comfort, pharmacology, reduction of risk. What's funny about those 3 subjects is that 2 of them are the #1 areas of failure. So that's why we do a lot of time in that this weekend. Okay, so she's got to focus on that for the last 2 weeks. That's just what she got to do. Okay, so you're going to look at that. That's what it says under number 7. It says go to the playlist and watch the videos in those areas. I have a whole area that says management of care. I have a whole area that says basic care and comfort. I have a whole area for all of these. Okay, so you're going to be fine. Then it says, look at the Oh My God packet daily. No work the week or the weekend before. Review every handout you ever bought or I ever gave you. Review every note you ever took. Look for your select alls. I'll teach you how to do that. Study pink. All the pink is a test. We already know that. Read and understand entire Oh My God and infectious disease packets. Fatal errors. Why would you fail or maybe get the maximum number? Believe it or not, the maximum number used to be 265 for the RN, 205 for the LPN. What is it now for everybody? 150. Yep. How many hours you got for everybody? 5 hours, right? So you never came to toe-to-toe. That's for the people in my class here. Did NCLEX questions only, never looked at videos or handouts. You just did the questions. You just focus on Uworld the whole time. Or if you failed 2 times, lots of people in the class fail more than 2 times or more. You took the exam before what? Put a star by that. That's everybody coming from another state in this room right now. That's you. That's the most important one for you because you're not in my class, physically in my class. So that is for you. Okay? Number 4, you completely underestimated meds. We've had people with 52 meds on their tests. We've had people with 47 meds on their tests. We've had people that remembered every single med, and every single med was up to 40. So You're going to get meds if you don't know them. They just going to pound your ass with them. Okay, so we do a lot with pharmacology. Being literally unworthy of the crown. Oh, that's confusing. Not really. No. If you're a piece of shit, this ain't for you. You trying to be Hank with the bank, the nurse with the purse, because you heard this shit is a lot of money. Well, that's nice, and maybe that's originally maybe the motivation that you had. But let me help you with this. There is no amount of money that can compensate me for the fucked up days I've had in nursing. Now, I love it, and I sing about it and praise it, but I will tell you honestly, there is no amount of money that can count for some of the days I've had as a nurse or as a provider. You couldn't pay me enough to go through the hell I went through that day. And it is absolutely a ministry. And you'll figure that out quickly because there's not enough money to pay you for what you just went through, for the bullshit you just went through. Okay? So at some point when you realize, oh my God, these patients really need love. They need care. They need a nurse. They need somebody to stop the doctor from killing them. They need somebody to intervene. They need somebody to help them with their family. It's so much shit you do that ain't nothing you learned in nursing school that made the bigger difference than your nursing school did. So you have to be that person. You have to understand, yes, it is a lot of money at first. I mean, you know, you make more money, more problems sometimes for some of y'all because y'all don't know how to spend it. But I'm here to tell you, because I'm going to give you a little holy hookup on your Money Matters for Nurses. When you get out of here, the best thing you can do, and the thing that young people don't do, but you got to do it, baby, I'm telling you right now, is you need to sign up for whatever company, 401k, put 15 to 20% in that bitch. By your 12th year, you're a millionaire. I'm your girl, trust me. So you go ahead and you're good about your money, but reality is your dude's selling drugs and you cool with that. You're going to be fucked. You buy, I just saw it the other day, me and my cousin was out there. We seen people buying hot shit off a truck. He don't like that shit. You know that ain't right. Okay, so you doing too, I mean, what is you doing? That ain't God. Okay, so you're not perfect, but you should be striving to be closer to him, be like him, be as much about him as you can. Not doing dirt, cheating on your man. You know, you don't give a fuck about your mama. She love you, but you don't care. You put a, you know, you throw away your old people. You don't care. You know, whatever it is that you think you might be doing that you could improve, that was what that was for. And I've had people stand up here and say, I knew my shit. I did good in school and I still failed. And I realized when I read that, I wasn't living right. And then when I got shit right with Jesus, I mean, for real, whatever God, Buddha, Allah, whoever, when I got it right, I really got it right. And you will be so blessed. I mean, like stupid blessed, like a crazy blessed. I promise you, you won't regret turning your life around. Okay? All right, so that's that. That's enough of the little 1 through 5. Now we're going to do your favorite prioritization delegation, pages 6 through 8. Here we go. The number 1 page on the test is page 6. Put it. Write it down. Number 1 on the test. This page. Page 6. It's number 1. I promise you. If you just knew this page, we could get you through a lot. Okay? Here's what I did for you. Raise your hand if you learned like I did that you're supposed to prioritize by doing the whole ABC garbage. I learned that garbage. It's all bullshit. Let me show you why. First of all, when you approach this test, it's not just the question, answer, move on, question, answer, move on. No, slow the fuck down.